So with that, I'd like to introduce Dr. Kathryn Chachula, Dr. Nora Ahmad, and Nadine Henriquez from the Department of Nursing, and Nadine Smith from the Department of Psychiatric Nursing for their presentation entitled Incivility in Nursing Education, Sources of Bullying and Their Impact on Nursing and Psychiatric Nursing Students. Thanks so much, everyone.
Thank you for that introduction, Madeline. I'm Kathryn Chachula, and thank you very much for the land acknowledgement getting us started today. And so we'll be going over the findings from a recent study that we had gathered data last year. And so we're pleased to present these findings today. And so let's get started. So for today's presentation, we're going to take you through these major elements of the research study, and all four of us are going to be speaking. So for the presenter, when you finished your section, just please let me know when you would like this slide advanced, and I will advance them on my end since I'm the one sharing the screen today. So we will start with the background first. And so many of us are familiar with bullying and incivility being rampant within the nursing profession. It's been well documented rather, for over 3 decades. When Meisner first said that nurses eat their young. And so we in this study did not take on a particular definition of bullying and incivility, but they have been referred to as acts of horizontal violence, relational aggression, incivility, mobbing, harassment, and interpersonal conflict. And regardless of the label, all of these various terms encompass a negative or unwanted act toward another person. And some scholars have argued that bullying and incivility in the nursing profession emanate from the corporatization of healthcare environments, hierarchical power structures, and interpersonal factors that can manifest as racism, sexism, and discrimination in both education and healthcare contexts. And the reason why we wanted to embark on this study was that there really have not been any recent Canadian studies that have explored what types of incivility nursing and psychiatric nursing students experience, or where those sources of incivility emanate from. And so we wanted to explore both the healthcare environment itself in clinical settings as well as education settings. And so we wanted to explore 4 specific research questions. Who are those individuals? What are the most common types of incivility that the students experience? And then we wanted to know if there's elements of racism or ethnicity that underscore some of the uncivil behaviors that the students experience. And what are those effects upon the nursing students themselves? And so to answer these 4 questions, we adopted a mixed methods design. And mixed methods means you're using both numbers and quantitative data in addition to student narratives and their stories, and analyzing both of them together to try and understand the research questions being posed. So there were 2 parts to this study. The first was a survey that we launched, and we invited all of the nursing students from both the nursing program and the psychiatric nursing program to participate. And it was an anonymous survey. We did not ask for student names to protect their confidentiality. And the survey allowed us, or allowed the students rather, to describe, what type of incivility they experienced, who it emanated from, and how frequent it occurred. And so there were 26 different types of behaviors that we explored within the survey itself. And this was based on prior research that has been published from the Bullying in Nursing Education questionnaire, as well as a Canadian study that was done in 2012. And that's the last Canadian study that we could find in the published literature, was 2012. So it's been well over 10 years since this has been explored. And then the narrative themes were analyzed using thematic analysis, using Braun and Clark's methodology. So who participated in the study? Well, most were female, and that's fairly reflective of the gender identity of those who are in our programs. 81% were aged between 21 and 30. Most of our participants came from the Bachelor of Nursing program, and roughly 40% came from the Bachelor of Psychiatric Nursing program. The majority of students self-identified as being white, 30% identified from a visible minority, and 10% were Indigenous. And surprisingly to me, over 54% described having a significant person in their lives, whether they were legally recognized as married or having that significant partner. And then we broke down here where all these students were taking their clinical placement. So it's no surprise that the majority were on a medical surgical type of placement. But we also had students in a number of other areas that included long-term care, palliative settings, acute psychiatry, community and outpatient settings, the emergency department, pediatrics. And we had one respondent who was only in classes and was not in the clinical setting. So altogether, our response rate was 19%, and that was with a student participation with 68 students. So in terms of the ethical considerations of this study, we had implied consent for those students filling out the online survey. And for any student who identified as being from a visible minority, we grouped them together. That way, all students felt comfortable that they weren't going to be singled out if they were from the Philippines or if they were from another country, that we did not specify their ethnic origin, just simply clustered together as a visible minority, and then respecting those who presented as Indigenous from being of a number of different Indigenous backgrounds that included First Nations, Inuit, and Métis. So in order to protect student confidentiality, we're using very limited descriptors just to protect those students who did participate. We're not going to be using any student names or even pseudonyms to describe the narrative findings or anything that could identify. And so for the forum activity where students presented their narrative, their experiences of what incivility meant to them, all of this remained confidential and anonymous for the purpose of disclosing what we learned as part of this study. So I will now turn it over to my colleague, Dr. Nora Ahmad, and Nora is going to walk you through some of the statistical findings. So Nora, you just need to unmute yourself there.
All right. Okay, in this study for the quantitative part, I use SPSS to analyze the data. If you can see on the table that there are 26 uncivil behavior. So I think this slide only show half of it, okay? The other part show another some incivility behavior. So after we analyze the data, we found that the number one that the student feel from their perception is that they are feel they are undervalued. The second one is they feel that the academic and clinical instructor expect them more than what they can do, where they have high expectation. And number 3 is resentment, which is 57.4. I think because the table is separate into 2, if you can see both, then it will be easier. So, and then we also look at who are the sources that of bullying from the student perspective. So for each category, you can see that whether faculty, whether clinical instructor or nurse. So if you can see in this table, for example, changing expectation is always from the academic faculty, and then second by the clinical instructor, and then the third is the nurse. So we categorize and rank for each incivility behavior so that we know who are the sources that they feel is the most that cause bullying and also uncivil behavior. So if you look at the percentage, if you can move to the other table, yes, this is the one. So if you look at high expectation, you can see, this is just example, you can see 63.2% the students say that faculty have a high expectation from them, and follow with the clinical instructor and also nurse. Another example that I can give is that like, okay, we can see generalization where they see that the patient is the first, come first, and then faculty and also physician and also nurses. So this is the example how we categorize, so that we know most of the thing is that like when come to the rumors and allegation, you can see that the student know the other table. Kathryn, go back to part 1. Okay, and then you can see the rumors and allegation. The first that cause of this uncivil behavior is that from the student itself, not from faculty member or clinical instructor. The first one is from their own colleague or their peers, and then follow with the nurses. So this is how we know that what happened outside there, and also in our university, so that based on this, where we discuss in the discussion and also recommendation that what we need to do, we have this data, we have this result from the finding. So what we need to do to make sure that this thing is not happen again, because if you see like 63.2 students say that we are hoping so much, the expectation is really, really high. So maybe we need to look at our objective and see what we can do. If you can move to the prevalence, the other one. Okay, I also analyzed about intent to leave according to their ethnicity. So we want to identify, okay, which group of students that think that after they experience bullying and uncivil behavior, so whether they want to leave the program or not. So based on this study, we found that one student from visible minority that say that they like, I mean, she or he feel that she would like to quit from the program. What we try to see here is that if you read the literature, they always say about First Nation or Indigenous students that always want to leave the program. But unfortunately, in this study, we found the result, which is a visible minority. I should say that all the data and results should be read with a cautious, because we have very small response rate, which is only 19.2%. So I believe that if we have more participants, and also maybe we do the whole university, not just a nursing student, I believe the result will be different. If you look at this one, this is considered very small participant that respond to the survey. So this is why our result is a bit different from other people. But saying that, we should acknowledge that when come to the sample size, when it's small, it doesn't mean that it's not going to give you any benefit. What we want to say here, that we know that most of the students, based on our survey, that they experience at least one or two type of bullying behavior. So we know from this that bullying happened in our faculty, and also in the clinical setting. So even though the response rate is low, it still benefit our Brandon University and also the clinical setting, because we know this uncivil behavior is happen outside there, bullying is happen outside there, and we should acknowledge that. If you look at the literature also, many researchers say that if you have small response rate, it doesn't mean that it's not give you any benefit, but it shows that the thing is happen in that particular setting. So if you can go to the, okay, sorry, no, go back to the other one. So in this statistic, I use Spearman Row because the data is not normally distributed. So we use non-parametric, and then we can see that this is significant, where you can see that the p-value is 0.031. What they try to say here is that ethnicity is somehow is significant with intent to leave. So what they try to say that maybe if we have a bigger data, it can show more, I would say, but even with a small number of participants, it still show that ethnicity and intent to leave are significant. If you can move to the other slide, please. Okay. Okay, this is only that the frequency of incivility by the student. So in year 2, you can see that most of them reported that sometime it's happened, where it's 17%. And then year 3, it happened more, 22 in some time, and year 4, 10. So based on what we found here is that incivility behavior and bullying is always happened in the faculty, and also I would say outside there when the student go for the clinical. Based on their year of experience, it will be interesting to see whether if they expose more, then they have more experience of bullying or not. But in this study, that's not the, the objective that we're looking for. But in future, maybe there will be more study about this. The other one, okay. I should pass to Nadine because the other one is about qualitative narrative finding. Thank you.
Thank you very much, Nora. And so now we'll turn it over to Nadine Henriquez to take us through the narrative findings.
Thank you, Nora and Kathryn. So our narrative findings, we essentially, upon analysis of the discussion group forums, we broke it down into kind of three central themes. We clustered together the student comments and experiences that were shared anonymously in this setting. And so our first finding identified here on the slide is practicing in a toxic culture. And so here students really kind of described incivility as kind of arising out of a toxic culture. And this manifested in different ways. It manifested as a lack of teamwork, aggressions from nurses or by nurses towards other nurses. And it also included unregulated workers such as healthcare aides and support staff in the clinical environments. So students in this case repeatedly observed kind of negative and unprofessional behaviors with other nursing staff. So here there were incidents of bullying behaviors that were not exclusive to just the students. And students here described nurses' attitudes and behaviors as being toxic. And they felt that this really negatively impacted both their learning experience and their self-esteem. The students also described kind of how they observed overall, a really poor morale in a number of different clinical practice areas, and how this morale really seemed to carry over into the poor treatment of students and other staff. And students described in these situations as feeling like a burden to the nursing staff. One student described how witnessing this kind of behavior really served to create an environment where they feared voicing any opinions or concerns. And so the first quote here, on one floor, I have experienced a significant amount of unprofessionalism from the charge nurse and other staff, gossiping and talking about certain staff when they aren't present. It is very disheartening and makes you afraid to speak up against anything when that behavior is demonstrated by those in charge. Another student described how witnessing this kind of behavior really served to create an environment where, I'm rereading my same sentence again. So some students also indicated feeling a lot of regret for entering the program and that they were thinking about quitting. And this was based on kind of how they were treated since they had joined the program, since they became students. And so that's what the second quote speaks to. I've been struggling as an older, experienced student and wished I didn't go into the program on many occasions because of how I've been treated as a student. You can go to the next slide. And so the next slide looks at the theme of feeling humiliated and being treated like a burden, which we kind of spoke to a little bit in the previous slide here. And so this is where students described just generally feeling humiliated or ignored or belittled by nursing staff in particular. Students were really quick to recognize that this kind of behavior was unprofessional, but they still expressed feeling empathy with the kind of the plight of where nurses are at right now, and just kind of the overall climate of nursing practice right now. And so they indicated that they felt this is related to, these high levels of nursing fatigue, and in general, kind of that impact of the novel coronavirus pandemic. So one student commented saying, I think it's very evident that nurses on the ward are getting very tired of the students, which isn't professional. But now that the workload is increasing due to the influx of patients that are getting elective surgeries, et cetera, they're just exhausted, both staff and us as students. And so although students felt humiliated at times and treated like a burden, they still remained hopeful for the nursing profession. And they were still continued to look forward to their future careers in healthcare settings, which gives us a little bit of a ray of hope as well, that they continue to remain hopeful. And just this next quotes here on the slide were just really quite poignant. Next slide. So another narrative theme is a lack of positive role models and support. And this really kind of speaks to, just in general, some of the kind of behaviors that were identified in the previous two slides. So students kind of reflected on witnessing mistreatment of other nurses and support staff, as well as, you know, that overall kind of lack of teamwork, lack of mutual respect for others. So students' experiences of incivility during their clinical placements, what this served to do was deter these students from working on those same units in the future. And so these findings really show how that, you know, students and staff are treated during their clinical placements are going to have implications as those same units seek to recruit students when they graduate and enter into the nursing profession. And so just a couple of quotes here. One student indicated, you know, they described helping the housekeeper on the floor, emptying the garbages in the patient's room. And the housekeeper remarked, you know, I can't remember the last time I actually felt seen or was helped. And it really speaks volumes with regards to, you know, how those staff are treated on an ongoing basis on that floor, or their perceptions of it. And another student here commenting, I love the skills and the patience, but I could never work there because so many of the nurses were just so toxic. And there's that term again, right? And it came up again and again, not only to students, but healthcare aides and other staff. So it was hard to see how there was just no teamwork or mutual respect for others.
Thank you very much, Nadine, for taking us through the narrative findings. And so now we're going to explore, you know, the findings of this study, how they related to other research findings and their implications. And so to take us through this section, I now invite Nadine Smith to walk us through this portion.
Thank you, Kathryn. So the findings of this research confirm that bullying and incivility within the clinical practice setting manifests in various forms. So for example, we gave some examples earlier. We went through the list of incivil behaviors that could include threats of physical violence, threatening the student to give them a poor grade on an evaluation, et cetera, et cetera. So similar to Budden and others' research, which focused on Australian nursing students, this research also found that nurses to be the main source of bullying behaviors towards nursing and psychiatric nursing students. Nursing students experience a variety of incivil behaviors as we went through. These uncivil behaviors are from numerous members of the healthcare team, as well as can also include faculty members, as well as their peer students. And evident in the literature, the clinical setting was found to be the key environment where student nurses encountered all of these uncivil behaviors. So again, what does the findings of this research mean? So it's imperative for faculty and other leaders within the clinical practice setting to play a role in fostering civil learning environments for nursing students. We also need to recognize diversity and inclusion within the nursing profession. As per Clark and others, they argued for the need of academic and learning environments to create sustaining communities of civility that includes diversity, equity, and inclusion, which is important because incivility in the clinical setting has been identified as having a significant impact on student nurses and can negatively affect their professional development. We'll continue on to some more implications. So further implications demonstrate that if students experience incivility on a certain unit, they are more likely to seek employment elsewhere in order to avoid that toxic environment. So there's that word toxic that keeps coming up. And again, this is an issue because we're dealing with a shortage of nurses. Nurses are burned out. And on top of that, we're dealing with the pandemic. So again, the clinical setting should be an environment where students feel supported, feel encouraged, and also feel welcomed, which will also assist with recruitment and retention. However, students in the current study reported that they're feeling humiliated at times, demoralized, and ignored by nurses within the clinical setting. And they also perceived the clinical setting to be an unprofessional and hostile environment. So the presence of bullying and incivility towards student nurses not only creates a toxic work culture, but also compromises patient safety. For example, students may be afraid to check orders for clarification. Ignoring and excluding students can lead to communication breakdowns, thus contributing to increased bullying behaviors. And as well, communication breakdowns can also be a patient safety concern. And I'll pass it back off to Kathryn.
Thank you very much, Nadine, for taking us through that. And so on behalf of our research team, we hope that you found those study findings informational, no matter the context of your work. So whether you're in the university setting or in the clinical practice setting, that we all have some work to do in terms of creating a welcoming atmosphere for students. And so, as Nora has already mentioned today, one of the key limitations was a small sample size. So we had 68 students participate in the survey with that response rate of 19.21%. But as Nora alluded, when your study findings are novel, it still adds to the nursing and allied health literature, regardless of that sample size. And because this truly has not been studied for over 10 years, it warrants taking a look at what these findings show today, given the contexts that our students have been practicing in. We've come through the pandemic, we've come through modified learning environments where we've moved to predominantly online teaching, etc. However, while this needs more study, please let us know if you're interested in working with us on future research. We would love to recruit a greater number of students who report experiencing incivility, intent to leave, further exploring if ethnicity plays a role in terms of incivility and intent to leave either the nursing profession, whether that's nursing itself or psychiatric nursing. And future research might include faculty perceptions, nurses on clinical floors, further exploring student narratives, and also clinical instructors' perspectives on incivility. So if you're interested in doing this work, please feel free to reach out to any one of us. These were all of the different references that informed this study. And so if you're wanting to reach out to us about this work, please don't be a stranger. We really want to thank the students for their participation in this research, and we want to thank you for your interest. And so we'll now stop the recording, and once Madeline stops the recording,